Recently, the CDC changed the 36,000 flu deaths per year figure and instead says that the death toll ranges from 3,300 to 49,000. One of the statistical issues is that the CDC places deaths from pneumonia along with deaths from the flu into the same category. On the CDC website, we see 55,220 deaths from influenza and pneumonia. When I open up the source document, which is the National Vital Statistics Reports, there's a breakout of deaths, and we see that only 4,605 of the 55,000 deaths were actually attributable to the flu. This was actually a very high number of influenza deaths compared to previous years, where flu deaths were as low as 500 in 2010. The CDC did admit that the 2014 flu vaccine was ineffective because the virus had mutated. The Cochrane Collaboration is an international not-for-profit organization comprised of independent researchers. Their role is to establish an evidence base for health and medical care by assessing the published literature to determine whether interventions like surgery, medical drugs, and nutritional supplements are effective at treating particular conditions. The work of the Cochrane Collaboration, which is published in Cochrane Reviews, is internationally recognized as the benchmark for high-quality information about the effectiveness of healthcare. So what is the Cochrane Collaboration's position on vaccines?
I started to look into vaccines because I was surprised. You know, when I looked at what they call meta-analysis of all the literature ever published on vaccines, there's a particular independent scientific body called the Cochrane Collaboration, highly respected, because what they do is they look at all the studies, they try to really identify if there's, say, industry influence. Because as you know, there's no real regulation as far as publishing studies. If you have a null or negative finding, you don't have to publish it. But if you have a positive one, you could be a vaccine manufacturer and spend 20 years and finally get a study that looks like, okay, there's a little bit of a relative risk reduction in some disease, and you publish that, and then that's all you see. Well, what they did, they looked at all the research on childhood vaccines and all the research on vaccines for healthy adults and elderly and those who work on the elderly, and none of the Cochrane review conclusions showed that they were proven safe or effective.
What got me started on down the rabbit hole in the vaccine issue is that the school, I was at BU, and you know, it was all about, oh, flu vaccine clinics, we have to model this as a disaster plan. And I was like, flu vaccine, God, you know, like nothing I've read have said that it's very effective. And so I started looking at the data, and I was looking at the Cochrane Collaboration. I had never really known about Cochrane before. Right. As a physician, never heard about Cochrane.
What is the Cochrane Collaboration?
So the Cochrane Collaboration is an independent group of international researchers, MDs, masters, PhDs, who work mostly voluntarily. Most of them are volunteer, and there's no industry money coming in at all. So they will not take any money that's related or tied even down the road to industry. So it's truly independent research, and it's collaborative. And the Cochrane Collaboration had put out almost every year a paper on a meta-analysis, meaning they're looking at all the different studies and they do a meta-analysis of the data, and show that, you know, the flu vaccine was barely effective, if at all, and that, you know, in any given year, for every 100 patients who are told they have flu, 7 actually have influenza. You know, so influenza is not even as you know, as prevalent as we think. You know, people say I have the flu, I have the flu. That just means they had, you know, a viral syndrome with maybe a fever and respiratory symptoms. They didn't feel well, so they had the flu. Yeah, right. But it's not influenza. Yeah.
In 2010, the U.S. Advisory Committee on Immunization Practices began recommending the flu vaccine for all healthy children older than 6 months. This was an expansion that they claimed was, and I quote, supported by evidence that annual influenza vaccination is a safe and effective preventative health action with potential benefits in all age groups. Yet a July 2012 Cochrane Collaboration systematic review concluded that for kids that were under the age of 2, the currently licensed vaccines are, and I quote, not significantly more efficacious than a placebo. In kids older than 2, the Cochrane analysis indicates that the flu shot reduces the absolute risk that a child will catch the flu by about 3.6%. A February 17, 2010 Cochrane Collaboration systematic review indicated that, and I quote, the available evidence is of poor quality and provides no guidance regarding the safety, efficacy, or effectiveness of influenza vaccines for people aged 65 years or older. To resolve the uncertainty, an adequately powered, publicly funded, randomized, placebo-controlled trial run over several seasons should be undertaken. On the package insert for Flulival vaccine, it states, and I quote, "There have been no controlled trials adequately demonstrating a decrease in influenza after vaccination with Flulival." There is one recent study from 2012 where a true saline placebo was used rather than another vaccine or a carrier that contained everything except the main antigen.
Interestingly, I wrote a letter to ACOG, the American Academy of Obstetricians and Gynecologists, stating, you know, I understand you recommend the flu shot. Could you at least recommend the single-dose vial? It's mercury-free. They wrote me back and said, we believe thimerosal to be safe. I said, okay, here is a picture of the bottle. It's got a skull and crossbones on it. And here's the MSDS sheet, which is a material safety data sheet by the company that says it's a mutagen for mammalian somatic cells. So in layman terms, it causes mutations in mammals, somatic germ cells, so eggs. So it causes mutations at the level of dividing germ cells, like an embryo. Hello? I said, what about this doesn't bother you? Well, we don't believe. I said, so do your scientists have data that the manufacturer of thimerosal doesn't have? Because here's a skull and crossbones and here's their MSDS sheet. And they were like, thank you, have a good day.
Dr. Bark mentioned that the MSDS, the material safety data sheet for the flu vaccine, shows that it is a mutagen. In other words, it changes DNA. Did you know that most vaccines, including the flu vaccine, Flulival, have never been tested for mutagenicity or carcinogenicity? This means that they have not tested to see if they change or mutate DNA or if they cause cancer. Wasn't thimerosal removed from the vaccines in 2003? That's what I've read.
Yeah, thimerosal was removed from 3 childhood vaccines in 2003, but the same year CDC mandated flu vaccines for pregnant women and for little children. Okay. And the flu vaccines at that time, almost all of them contained megadoses of thimerosal. So children who were receiving vaccines after 2003 could get as much thimerosal as children prior to 2003, prior to the removal in 2003 from those other 3 vaccines. And for the first time, they began giving it to pregnant women. So children were getting thimerosal at a much more vulnerable period of their lives. So it's kind of a myth to say that thimerosal was removed from vaccines. It was removed from some vaccines, but it was added to others.
They put it into multi-dose vials because if you have to put 10 needles into the same vial, it's cheaper to produce. Once you produce the vaccine, it's cheaper to put 10 doses into one vial than it is to put 1 dose into one vial. And when they do that, they put the mercury in it as an antimicrobial agent because
preserve it.
Yeah, you're putting 10 needles in it. So it saves about 15 cents per dose.
Multiply that out times billions of doses.
Yeah, they're saving lots of money. But if you think about it another way, do you think your child is worth 15 cents?
Yeah.
If the difference is between getting toxic mercury and not getting toxic mercury and it's 15 cents, that's the difference?
When I interviewed Neil Miller and he asked this question about whether a parent would purchase a vaccine with mercury in it in order to save 15 cents, I thought that was a rhetorical question and that nobody in their right mind would do that. However, I recently visited Washington, D.C., and Robert F. Kennedy Jr. and his team, we met with several congressmen and congresswomen to discuss this very topic, specifically the multi-dose flu vaccine, which still contains thimerosal, or mercury. We had an incredible meeting with Congressman Posey and his entire team. I'm not at liberty to mention his name, but we also met with a congressman who told us that since he always pinches pennies, that he would opt for a cheaper vaccine with mercury in it if it saved him some money. While I was in Washington, D.C., I met with several mothers who have children with gastrointestinal issues and also autoimmune disorders.
There was a study in the Journal of Vaccine back in 2012 that looked at the injection of the flu vaccine into pregnant mothers. No one had ever measured what happens to the immune system. And what they found was that by injecting the flu vaccine into pregnant mothers, there was an increased circulation of inflammatory immune markers. But no one really understood what those inflammatory markers actually meant to a growing fetus. There are studies in the literature that clearly say schizophrenic disorders, psychiatric disorders, and autism have all been found to have as its precursors a history of inflammation in utero.
We understand that autism, for example, is an inflammatory condition in the brain. The Vargas study back in, I think it was 2005, showed universally autistic kids at autopsy had brain inflammation. They just looked at motor vehicle accident kids who happened to be autistic and had some controls who weren't, and there was a huge difference. So inflammation is part of the process. We want to avoid inflammation. There was a study that showed, I think it was the flu shot in pregnancy causes an increase in CRP, which is an inflammatory marker. So right there, that's telling me that's probably not wise to be injecting a vaccine that causes inflammation in the womb when we know there's another study that shows inflammation in the womb is associated with increased autism risk.
In some states, if a doctor takes that multi-dose vial and drops it by mistake on the floor and it breaks, he is required by law to evacuate the building and to bring in hazmat crews to clean it up before the building can be reoccupied. Hazmat crews wearing moon suits and respirators. So, and we're taking that same toxin, and flu vaccines have to be treated as a hazardous waste if you're going to dispose of them. That thimerosal vial is legally a hazardous waste. It can't be disposed of in a garbage can. Yeah, we're taking that and we're injecting it into pregnant women and little babies. And if it's early in the pregnancy, which is recommended under the current advisories, a little baby could be getting as much as 1 million times what EPA says is safe.
Let's figure out exactly how much thimerosal is in the multi-dose flu vaccine. The multi-dose flu vaccine has 25 micrograms of thimerosal. The shot is 0.5 milliliters, so let's do some math. So 25 micrograms in a 0.5 milliliter shot, same thing as 25 micrograms in a 0.0005 liter shot, or 250,000 micrograms in 5 liters, or 50,000 micrograms per liter. Well, 1 microgram per liter is the same thing as 1 part per billion, therefore the shot has 50,000 parts per billion of thimerosal. Now remember that 2 parts per billion of mercury is the mandated limit in drinking water, and normally 200 parts per billion would label something as a toxic hazard. So the multi-dose flu shot has 250 times the allowable limit of mercury in a toxic hazard.
It's very well known that if you've got a flu shot 1 year, while it might help you if you're one of those few people that it does, I think you have to vaccinate 100 people to, prevent the flu in a handful. If you're one of those people, the following year, you're likely to be more susceptible to a pandemic if it comes through. And again, that's been shown in reality in populations, and it's been shown experimentally.
What people don't know is that CDC on their own website have now admitted that in the last 10 years, the flu shot doesn't work half the time, and in some years, it doesn't work at all. And that's their own information, okay? About 75% of people who get vaccinated can still get infected with the flu. They can still pass the influenza on to other people. But in this country, most of the symptoms that we have during the winter, what they call the flu season, coughing, runny nose, fever, are not due to type A or type B influenza. Only about 20% of those symptoms actually are type A or type B influenza. And every year the government tries to guess which strains of influenza are going to be circulating. Lots of times they don't guess right, but you still take a risk when you get that flu vaccination. There also are studies that show that children who have had seasonal influenza shots actually are more likely to get infected when a pandemic flu strain comes around. That occurred in 2009.
There was a study out of Canada, I think it was last year, where they looked at people who had gotten the flu shot every year compared to people who hadn't gotten the flu shot, and how did they respond to a new flu virus. right? Because they're always trying to predict what's going to be the next flu virus. Those who had not been getting those yearly vaccines were much less likely to be infected by a new strain. So there's something about over-vaccinating that actually harms your ability to fight other infections.
On the CDC's website, they state that the flu vaccine is 50 to 60% effective among the overall population during seasons when most circulating flu viruses are like the vaccine viruses. Neil Miller just stated that the flu virus is constantly mutating, so what is the probability that the virus strain in the vaccine is like the virus strain that's currently circulating?
Early on, we want to be exposed to childhood illnesses because they're actually part of the developmental process of the immune system. So there was an interesting study that just came out. It was in Science magazine, November 2016. And it's saying that, I actually love the summary, it says it right here. The first influenza attack that a child suffers can affect the way that their lifelong immunity to the virus builds up. What they found is there's an actual imprinting process that happens, that when we're exposed to the virus, it imprints our whole neuroimmune system so that later on we'll recognize that and we've got that handled. And so they found that in older individuals who were exposed to the viruses as youngsters, it meant that they were less susceptible when they were older.
What's your opinion of flu shot?
Well, it makes no sense. And here's why. Number one, the virus most likely to cause the flu illness is rarely an influenza virus. The incidence of actual influenza virus illness is very, very low. Most illnesses that lead to flu-like symptoms are not caused by the influenza virus. The vaccine itself is toxic. When people say they got the vaccine and got the flu anyway, no, they got poisoned. And the body's response to being poisoned is to get sick, to remove the poisons, because you were injected with poisons. For those people who don't get sick after the flu vaccine, the materials stay inside, or if they're lucky, they'll just excrete them out without being affected.
Why do I not get the flu vaccine? The only time I've ever felt sick is after getting a flu vaccine. I haven't had the flu or had a serious illness in over a decade.
While I was interviewing Dr. Thomas, he discussed the topic of quality measures and the pressure that's placed on pediatricians to vaccinate according to the full CDC schedule. He also mentioned the financial incentives that are in place to make sure that pediatricians do vaccinate.
One thing that as a pediatrician I'm subjected to is quality measures. And if you're a pediatrician, the health plans who set out quality measures invariably have one, two, or even several quality measures that are basically how well are you vaccinating. So I just got a report, for example, from one of the health plans this past week that had my vaccine status level at 0. Okay, and I can tell you that probably 95% of my patients are vaccinated, but they're not. The 0 is because almost none of them have done the hepatitis B vaccine because they're not at risk for that one. And that automatically puts you in the unvaxxed category. So there's this pressure on doctors to do them all now, follow the schedule. This keeps you in line with quality measures, recommendations from the CDC, recommendations from the AAP. It's a lot of pressure on doctors to conform to the one-size-fits-all that you were talking about. We need quality standards that look at what's your autism rate, what's your ADD, your anxiety rate, your diabetes rate, your asthma, your eczema, your hospitalizations, your ER visits, your clinic visits, you know, all these real quality measures that look at the health of the population. And I would love for those studies to be set up, and let's look at the differences in populations that are highly vaccinated, selectively vaccinated, or unvaccinated. Follow them and look at long-term outcomes, and then we'll have some quality data that's worth, you know, shouting at the mountaintop.
Pediatricians and doctors what I've found is that they don't read the science. You know, that for them, CDC is a judicious arbiter of the science. So if CDC says there's no evidence, they're not going through the abstracts and going out to PubMed and looking up hundreds of documents and trying to make up their own mind. And I understand that because it's a lot of work. I mean, it took us 3 years to do this book. And we had some really great scientists and doctors looking at it. And, you know, it's hard to figure out how much weight to give to individual studies, et cetera. So people just accept CDC's word that this is all safe. And then there are very, very strong financial incentives for doctors to get their patients to comply with the CDC schedule. Doctors are punished financially and very dramatically. Insurance companies like Blue Cross Blue Shield, if they don't get a certain percentage of their patients to comply with the schedule. If 63% are not compliant, they don't get any of their bonuses. If a pediatrician does not persuade his patients to comply with the CDC schedule, he suffers a terrible, terrible financial punishment from Blue Cross Blue Shield.
This year in the Blue Cross Blue Shield handbook that came out, it actually talked about something called the Combo 10, that in a pediatrician's office, if they have all the children under the age of 2 that have been fully vaccinated with all 10 of these vaccines called the Combo 10 by their 2nd birthday, the vaccination rate in the pediatrician's office needs to be 63% of their entire practice needs to be fully vaccinated by this Combo 10. And if they are rewarded by Blue Cross Blue Shield at $400 per child, per eligible member. So if you've got 1,000 kids in your practice and 63% of them are fully vaccinated, you get 1,000 times 400 in terms of a bonus from Blue Cross Blue Shield for following through on their standards.
Just to speak about the financial incentive to vaccinate. So I'm a busy pediatrician. I have 13,000 patients. And I started my practice 8 years ago with about 1,000 patients who came with me from my old group practice. So we've grown from 1,000 to 13,000. We've got a selective schedule. We've got an informed consent process that results in, less than CDC schedule vaccinating, right? Probably less than half of the CDC doses are given here. So we're still vaccinating, but we're vaccinating quite a bit less. And I've done the crude math on it. I've lost over $1 million just in administration fees. So for each time my nurse gives a vaccine, there's an average reimbursement of somewhere around $12 to $14. And if you're giving 2 vaccines, that's double that, or in other practices where they're giving 6 different vaccines for a 2-month-old, multiply 12 to 14 times 6. And then you multiply that by all those recurring visits. It's a huge moneymaker for pediatricians, even though they don't like to admit it. They don't want to acknowledge that they're making money on vaccines. It's a huge part of your bottom line. Pediatric practices are very expensive to run. We have, nurses giving advice. We have doing referrals. We have billing costs and reception costs. I mean, there's huge overhead. It usually runs around 80% for most practices. And so most pediatricians wouldn't survive without the income that comes from vaccines.
It takes conviction and fortitude to deviate from the CDC schedule, especially if you're a pediatrician. The financial incentives and the penalties are tremendous. While countries like Japan have delayed vaccine schedules, in places like the USA and Australia, that choice is not readily available.
In Japan, what happened is the vaccination, children are vaccinated against the 3 types of vaccination they're given to children. But by the time they're about 2 years of age, not below 2 years, because between birth and 2 years of age, the immune system of these children develops in a way that is able to to protect the child and for the child to be able to actually deal with the vaccination. Now, in some countries, this is not the case. The age is actually lowered, so much so that there are other countries where vaccination is given at birth. And so there have been some statistics that have proven that in those populations where the vaccination was given very, very, very early on in life, those children didn't do very well.